பேசையில சும்மா அட்வைஸ் பண்ணிட்டு விட்டுருக்கு. அதனால நீங்க ஒண்ணு பாருங்க.
Dr. Udita, shall we start now or it's live streaming now?
Okay. Okay. Good.
We are live now.
So shall I start?
Yes.
Yes. Good evening, everyone. Welcome to the Veterinary webinar series. So today we are going to discuss about the vaccination protocols of small animals. So to formally welcome you all to the webinar, I cordially invite Dr. Yushika Dharmasuriya, President of the Sri Lanka Veterinary Association. Over to you, Dr. Yushika.
Thank you very much, Dr. Udita Vijay Singha, Secretary, Sri Lanka Veterinary Association. Dear Dr. Yushika Dharmasuriya, dear doctors, SLVA members, dear student, you are welcome to SLVA Vet Connect webinar series once again. This is the fourth time SLVA is conducting webinar series internationally. We planned this series covering all the area representing veterinary field. First of all, I warmly welcome our resource person, Dr. Yushika Dharmasuriya, from Zootopia Animal Hospital in Colombo. Thank you, Dr. Yushika, for accepting our invitation on behalf of SLVA. And I highly appreciate for your commitment to uplift the veterinary field in the country. And I would like to welcome our moderator, Dr. Chandika Vikramasinghe, and all the SLVA members and the student. And I know now I am in a WVA conference. Most of the veterinarian in the world are engaging with SLVA YouTube channel with CPD series. So it's a great achievement we received from the world community. Today our topic is small animal vaccination protocol. Thank you very much for everyone and warmly welcome you all to the webinar series. Thank you.
Thank you, Dr. Sugat. So today's program will be moderated by Dr. Chandika Vikramasinghe. So I cordially invite Dr. Chandika to introduce our resource person, Dr. Yushika Dharmasuriya, and moderate the program. Over to you, Dr. Chandika.
Thank you, Dr. Udita, Secretary SLVA. So before introducing our resource person, I would mention a few words about the structure of the program today. So it's going to be about 1 hour lecture, then followed by a Q&A session. During the Q&A session, you can use the raise hand option to ask questions. Then I will allocate a chance to each and everyone to ask the questions. And also, if you want to type your questions, you can type the questions, and then I can read out the questions, and Dr. Yushika can answer those questions. And also make sure during the lecture, please keep your phones in mute format so that we will not get any disturbance from the surrounding noises. So before going into the lecture, so today's lecture is the topic is 2024 vaccination guideline for dogs and cats and serology testing, which is a very timely lecture because we different clinics have slightly different protocols about dog and cat vaccination. So from today's lecture, we can know the latest world guidelines about dogs and cat vaccinations. So a word about Dr. Yushika. So she graduated in 2014 from the Faculty of Veterinary Medicine and Animal Science, University of Peradeniya, Sri Lanka. And she was just after passing out, she was a junior lecturer in the same faculty for the years of 2014 and 15. And currently, she is the owner and director of the Zootopia Vet Clinic Nugegoda. And she has a clinical interest mainly in veterinary cardiology, feline medicine, and also currently a member of the ISFN, which is the International Society for Feline Medicine. And under her name, there are several local and international publications on feline medicine, small animal surgery, internal medicine, ultrasound scanning, and veterinary cardiology. And she is also the current Assistant Secretary of the Sri Lanka Veterinary Association. And she's Since 2024, she has been organizing monthly discussions in Small Animal Vet Hub in Sri Lanka, which is a society for improving knowledge of small animal veterinarians in Sri Lanka. So she is a very clinical based veterinarian. So I would invite Dr. Yushika Dharmasuriya to start the lecture. Over to you, Dr. Yushika.
Thank you so much, Dr. Chandika, for the introduction. I'd share the presentation with you. So good evening to you all. So I'd like to welcome all of you for today's webinar. So my presentation, I need to tell you the resources and the credits. So WASAVA 2024 guidelines and American Hospital Association vaccine guidelines. And also I have referred many of the details from Professor Mary Markanda's presentation, who is the head of the WASAVA 2024 guideline committee. So the purpose of today's presentation, I'd like to tell you that this presentation is to create a guideline for the vaccinations based on scientific evidence, which can be adopted by Sri Lankan veterinary practice. So I really want to create awareness of having it legally approved to avoid harms to our pets, as well as for all of us practitioners by excessive vaccinations to prevent that, and also to know how much is sufficient and to give not to give insufficient vaccinations. So these guidelines are intended to provide national small animal veterinary associations, veterinary practices, and individual veterinarians with broad, up-to-date, scientifically supported advice about vaccinations of dogs and cats. They offer strong advice in some areas, but these are not a set of rules. So for today's guideline, concerns of the safety of repeated administration of vaccines, how to collaborate human and veterinary medicine guidelines, and also I will talk to you about how to vaccinate pets safely. Individual protection and herd immunity is one of the most important things that we need to talk about. So these vaccination guidelines are non-compulsory recommendations which assist practitioners in using vaccines efficiently based on current scientific thinking and expert opinion. Now, for an example, if you receive a 1-year-old dog who is not vaccinated, and also a puppy at 6 weeks of age, or another dog who's not been vaccinated for a year or 2 years. So we have to always put our thinking cap. So I'm merely explaining you how to cater each and every individual based on the scientific thinking, based on the guideline I'm providing you with today. So we have been practicing one size fits for all these years. That means at 6 weeks of age or 10 weeks of age, we've been doing the same protocol mostly, using the same guideline, the same interval, and same vaccines. So this is not what we really want for every individual patient. So consider infectious diseases risks is very important within that area. And also, based on the country, what sort of vaccinations we need to adopt. First of all, we need to, sorry, I think if you can mute your microphones, I would really appreciate it. It's hard to concentrate otherwise. Dr. Chandika. Yeah. So regarding the medical records.
Please mute your microphones.
Thank you. So medical records and documentations are one important area that we need to think about as veterinarians. So the date of vaccine administration is really important for all of us, and the identity of who is the vaccinator, the initial or the code, Sri Lanka Veterinary Council code, and the person administration the vaccine. So these are really important things that we need to put down in the book. And the name of the vaccine, lot and the serial number and the expiry date with the manufacturer. So this comes with the sticker. So you always have to check what sort of a sticker and what sort of the part that you have to take out from the bottle and paste it in the book. So you have to make sure that you keep these details in the book for the future references. And if possible, the anatomical site and the route of vaccine administration is really important for us to know if there are any tissue reactions or soft tissue sarcomas or anything with related to our vaccinations. And the adverse events in the book to alert the vets about the issue is also really important. So for the ease of knowing the vast vaccine availability in the world, we are dividing it to core, non-core, and not recommended vaccines, because we are having a wide variety of vaccines all over the world. So in the WASAWA guideline, they have divided it to our ease of understanding. So core vaccines, all cats and dogs should receive based on the geographical area. The core vaccines may be added. For an example, Leptospira and anti-rabies vaccines may be added in some areas of the world. So because of the geographical area. So there are non-core vaccines recommended to animals who are at risk because of the geographical area, location, and their behavior, and the lifestyle and the places. So these can be added based on the need of the region. And there are some vaccines which are not recommended by the WASAWA, which has no sufficient evidence to justify their use. So there are research which is supporting these vaccines. So sometimes if there is no evidence which is supporting, they have rejected to use this. So the core vaccines in our country, dogs, canine distemper, canine adenovirus, canine parvovirus, anti-rabies, and leptospirosis are the main 5. And when it comes to the cats, feline panleukopenia, feline herpes, feline calicium, and anti-rabies are the main 4 vaccines we use. So based on the pattern of the vaccines we are using, whether it's modified live or attenuated vaccines, it is really important to understand what sort of a vaccine we are using each day, because based on the type of the vaccine, we have to use our thinking cap again in instances which is not so common. So to cater the need based on these instances. So live attenuated whole organism infected cells replicate. So these modified live vaccines will be infecting the cells and replicate, which causes low level and transient infection mimicking the natural infection, which is more immunogenic than a killed vaccine. And it is also consistent and lasting, having a lasting immune response. And this strong immune response after a single dose will be seen. And there we also find inactivated vaccines. So these are entire killed microorganisms. These are not able to infect any of the host cells, but it is less potent. However, these are giving a transient immunity. It may require an adjuvant, generally require multiple doses than the modified live vaccines, and it has a shorter duration of time when compared with MLV. More frequent boosters will be required than the MLV vaccines. So for examples, leptospirosis and anti-rabies vaccines are to be mentioned. However, anti-rabies vaccines have longer duration than the leptospira vaccines because it's a highly potent immunogenic vaccination available. Then we have recombinant vaccines. This recombinant DNA technology is used in these vaccines, which is the most modern technology we have. This is intended to protect puppies against parvo vaccines, infections at very young age, like 4 weeks of age, breaking through maternally derived antibody interferences. So these uses are really important in these instances. So these vaccines are available in our market as well. So to understand what I'm going to talk to you about next, depending on what you understand in this slide. So I'm going to talk about the antibody levels in a puppy. So when we are giving a vaccination, we know that there will be antibodies which is made out of this vaccine. And also, if it is a puppy, the puppy will be having maternally derived antibodies. So depending if it is in a higher level or a lower level, the response will vary. So these maternally derived antibodies also will be based on the amount of colostrum the puppy takes from the mother. So we can't really predict it. However, if the maternally derived antibodies are extremely higher, so there will be no response from the vaccination we will be giving. And if it is at a lower amount, then there will be an elicit of response from the vaccination we give. So in this chart, I'm trying to explain to you about the maternally derived antibody interferences. So in the x-axis, you can see the age in week of a certain puppy or a kitty. And in the y-axis, you can see the antibody levels. So in this example vaccination, we are talking about the antibody interference level. That means if the vaccine interference level will be 20. And the protective antibody level, they have a big gap. So it will be around 80. So if an animal is having an interference antibody level, that animal won't be protected from diseases. But when we give a vaccine, it won't elicit a response if it is not lower than the interference antibody level. Now, when we talk about the protective antibody level, that is the level which is needed by the animal to get protection from a certain disease. Now, as you see, there is a certain gap in this too. Now, we'll take an animal as an example. So as you can see, this animal will be intercepting the protective antibody level at age 11. However, it will have lower interference antibody level than that, and it will be coming after 14 weeks. Now, for the first instance, as you can see, the interference level, the intercepting level of the protective antibody level, it is also mentioned as the protected by maternally derived antibodies. And then we will have a window, as you can see, from the protective antibody level to the interference level, where the animal becomes susceptible to disease. How much ever vaccinations we give for certain animals, this susceptibility window will always occur. Now, we cannot predict where this window comes. Now, there will be, after 14 weeks of age, there will be response to vaccine area after the interference antibody level becomes really low. Now, imagine if we give a puppy a parvo vaccine at 6 weeks of age, and there will be another vaccine given at 10 weeks of age, and another vaccine will be given, third vaccine will be given at 14 weeks of age. Now, 6 and 10 vaccines which we have given will not elicit a response because of the interference of the maternal derived antibodies. At 14 weeks of age, when we give the vaccine, it will elicit a response, which is going to be achieving the protective antibody level of this animal. Now, if we take another animal, it will go up to 16 weeks of age, and the susceptibility window will move a little bit away from the typical window I have shown earlier. So that is why I said that we cannot predict where this window appears in a certain animal. And at 16 weeks of age, we have to give another dose. So most of the animals, 90% of the animals will be having less maternally derived antibodies by 16 weeks of age. So we have to give another vaccine at 16 weeks of age to elicit an immune response. So these multiple doses of vaccines against distemper, parvo, adenovirus, and panleukopenia are not boosters. So we are merely trying to elicit an immune response as soon as possible by giving multiple vaccinations and different instances. Now, I will try to explain the instances and the examples we get patients in our clinic. So if we receive a patient at 6 weeks of age and we give the vaccinations at 6 weeks, we will give another dose at 10 weeks and 14 weeks of age. At that instance, since the animal is not past 16 weeks, as I have mentioned earlier, it is always recommended to give a final dose after 4 months, that means 16 weeks of age. If we get another patient at 8 weeks of age, we give parvo, distemper, and adeno or panleukopenia vaccines at 8 weeks, 12 weeks, and 16 weeks of age. At this instance, we don't have to give another vaccine until 26 weeks of age. The new WASAWA guideline always mentions that we have to give another final dose at 26 weeks of age if we do not have serology to test if an animal has proper safety antibody titer in their bloodstream. So if we don't have serology, they always advise to give another dose at 6 months or 26 weeks of age. So I'm going to talk to you about the core vaccines of puppies. So the core vaccines are distemper, parvo, and adenovirus. So I'm going to talk about these viruses first. So we have to start the vaccinations between 66 to 4 weeks of age. You have to always look into the guideline of a certain vaccine before giving any vaccines to any of the animals, because sometimes depending on the brand or depending on the variety of vaccine you use, the guidelines may vary. So they have a least age to administer certain vaccinations. So these vaccinations should be repeated every 2 to 4 weeks until an animal is 16 weeks or older. So the 2 weeks intervals comes at areas where animals are in high density shelters or high density areas, or who are very susceptible to disease. So usually the patient comes to us, you can use 4 weeks intervals until 16 weeks or older. So the last dosage, as I mentioned, if you don't have serology, it has to be 26 weeks of age. When it comes to the core vaccine of an adult, after the last dose in 26 weeks of age, they are always recommending to revaccinate it every 3 years. If a dog comes to you after 26 weeks of age, you only have to give one vaccine of modified live vaccines until you booster in 3 years, because these vaccines elicit a stronger immune response. When it comes to anti-rabies in dogs and cats, it is advised to follow the local guideline by the Wasawa community. At presentation, we are advised to give the vaccination at any given stage to a stray animal. And it has to be repeated after 4 to 6 weeks. If it is 1 month or 6 weeks or 12 weeks, we have to give the vaccines at that instance if it is a stray animal, and repeat once after 16 weeks. If it is an animal whose mother has been vaccinated, you can start the vaccine at 10 weeks and then repeat after 16 weeks. However, 26 weeks booster vaccination was mentioned that it is important based on the literature, which I will refer to you at the end of the presentation. And then annually, as law requires by Sri Lanka. However, we need proper update after research, or a national guideline has to be prepared if there are any updates in future research. So the veterinary epidemiological bulletin in Sri Lanka has suggested this vaccine protocol, and they have mentioned 1 year after last booster. However, 26 weeks booster is essential based on the research which is published in Sri Lanka. When it comes to leptospirosis, the incidence in Sri Lanka in the vaccinated and non-vaccinated dogs, I would like to make your attention to one of the research articles. So in this research article, they have checked 96 unvaccinated and 82 vaccinated dogs. So in their research, they have found 15.6 unvaccinated dogs has been shedding the leptospirosis, and they have tested positive in the DNA in the urine, while 15.9% vaccinated dogs also have been shedding DNA in their urine. So the reactive serogroups in the unvaccinated dogs were Sedro, Canicola, Ictera hemorrhagiae, and Javanica. So as you can see, Canicola, Ictera hemorrhagiae are in our vaccines. So specifically, these are unvaccinated dogs who has been shedding them. So when it comes to the vaccinated animals, they were infected with these strains where you cannot see Canicola and the Ictera hemorrhagiae. So they were specifically protected by the vaccines they have been given in the Kandy district. Although vaccines protection against infections with homologous serovas included in the vaccine, dogs can become infected with other serovas. Serogroup Sedro was predominantly reactive in both the vaccinated and unvaccinated groups in this study, which we have to think about in the future. Also, there was another study where they have yield specimens, urine specimens from 20 vaccinated dogs, and they have also been positive for unvaccinated serotypes. So when it comes to the etiological agents causing leptospirosis in Sri Lanka, a review has been published where these serovars were positive in humans. So as you can see, Icterohemorrhagiae, and also Canicola, Grippityphosa, and also Pomona was positive in humans. Why I'm mentioning this is for you to choose the vaccines depending on the serogroups available in the vaccine. So in Sri Lanka, there are several types of vaccines. So the highlighted Icterohemorrhagiae, Grippityphosa, Canicola, and Pomona are the ones which is available in most of the vaccines we have. So based on that, the guideline always say VASA guideline to start the vaccination at 8 weeks of age at first and repeat after 2 to 4 weeks as the other vaccinations. Annual vaccinations were essential because these are killed vaccinations. So you have to give stronger immune response, and you have to get the immune response by annually vaccinating than the modified live vaccinations. So if an animal is presented more than 16 weeks of age, you have to give 2 doses, 2 to 4 weeks apart to get a proper immune response, unlike the modified live vaccinations, which we spoke earlier. If a dose is missed in an adult animal for more than 18 months, so this is really important to remember, unlike any other vaccination which we have spoken about. So if an vaccination is missed more than 18 months, it is advised to repeat the dose in 2 to 4 weeks and give 2 vaccinations apart. So I'm going to talk about the duration of immunity. So we can always cater our patients depending on the scientific guidelines. So the duration of immunity against leptospirosis in this study, they have taken young dogs who were vaccinated twice by a certain vaccination, which we all have in Sri Lanka as well. And they have checked the antibody levels at 5 weeks, 26 and 56 weeks. Duration of immunity of 1 year can be attained against the infection based on this study. So not more than that. So based on this study, currently available Leptospira vaccines has short-term immunity, though to be less than 18 months. So several challenge studies were there, so you can refer to them and also read. So the question pops again in the mind, if a dog received its last Leptospira vaccine 18 months or more, do I need to recommend starting the series of vaccinations again? So the answer is yes. You have to give 2 vaccines 2 to 4 weeks apart. The duration of immunity in modified live vaccines, distemper has proven to be 9 to 15 years. Adenovirus is 9 years. Parvovirus was 9 years. So in natural environment where the virus was not there, the distemper, adenovirus, and parvovirus had duration of immunity 14, 14, and 10 years respectively. And in environments, it was free from the viruses. Distemper was in for 9 years, adenovirus and parvovirus also for 9 years. So as you can see, the modified live vaccines had longer duration than the killed vaccines. So in this example, they have done research in 235 dogs who were more than 2 years of age. So these dogs had vaccinations. The last vaccine of the modified live vaccine was 1.5 to 9 years of age. That means the last vaccine sometimes was 9 years ago or 1 year ago or in between. So there were they have given another dose of vaccinations of the MLV, and they have taken blood samples in 7 and 14 days post-vaccination. They have analyzed the antibodies, PAVO in hemagglutination inhibitor test, distemper adenovirus neutralization test. So in these animals, as you can see, total serological responders were more than 95% in all diseases. So parvo, distemper, and adenovirus, despite of the time the last vaccine was given, they had a proper response of 98.7 for parvo, 96.6 for distemper, and 99.6 for adenovirus. Now we'll talk about the core vaccine of cats or kitties. So we have panleukopenia, calici, and herpes virus we are going to talk right now, as we have discussed the rabies with the dogs before. So the start of the vaccination has to be between 6 to 8 weeks. Now again, most of the time we have to refer to the vaccine guidelines of what you use. Sometimes they recommend 8 to 9 weeks as the least age in some vaccinations. So always refer to that. And the vaccination should be repeated 2 to 4 weeks until more than 16 weeks of age. The last dosage should be at 26 weeks if you do not have the tests for panleukopenia antibody tests. So the core vaccines of an adult, the panleukopenia, solid immunity for many years, and herpes and calici, it gives a partial protection. You have to always mention this to your clients to avoid unwanted misunderstandings. So it does not protect against the infection or developing it to a carrier stage. So it gives a partial protection. So that is why you see positives after giving the vaccination sometimes. Now, for the ease of understanding the basis of giving the vaccinations, I have divided the cats into 2 different parts. So there are low-risk cats who are in solidarity, indoor cats who do not visit the catteries. So you can revaccinate these cats every 3 years. Now there are high-risk adults who are very social cats. And after the last dose in 26 weeks, revaccinate every year for calici and herpes. Why I have mentioned these two separately is in some countries, they have these vaccines separately. So you don't have to vaccinate panleukopenia every year. However, in Sri Lanka, we have all 3 together. Therefore, we have to give the vaccinations once a year, despite it includes the panleukopenia virus. So this is for cats who visit catteries, who roams outside and associate with infected cats. The duration of immunity, they have done a study for panleukopenia virus vaccination in healthy adult cats using 112 adult cats. And they have given the vaccine to these cats, and before vaccination and after vaccination, 7 and 28 days, they have taken blood tests. So a positive titer has been taken as 4-fold titer increase, which is the adequate response to vaccination was defined as such. They have used the hemagglutination and inhibition tests to test these antibodies. So pre-vaccination antibody titers, if it was really high, there were 64.3 cats out of the lot of 112 cats. 4% was non-responders, and 47.3 of cats had an adequate response to vaccinations, which was a 4-fold increase. So as I mentioned earlier, if a cat was having high level of antibodies in their blood for panleukopenia, they did not respond to the vaccine which was given. So that means these vaccines are of no use if we give it too early to these animals. So how do I know my patient is protected? So how do we decide whether you have to give the vaccine in 1 year, 2 years, or 3 years? So what you can do is you have to always think about serology. There is a strong association between the serum antibodies and protection of panleukopenia, adenovirus, and distemper, and canine parvo. No antibodies does not mean necessarily that an animal is not protected, because most of the patients are having memory cells, which is eliciting an immune response. but can't measure, therefore, we cannot measure the memory cells, therefore, we are measuring the antibody levels. So now when it comes to herpes and calici, the antibody titers are not giving any idea about the protection of these cats because in herpes virus, cellular immunity, presence of neutralizing antibodies in a few vaccinated cats and many cats are protected even without the presence of antibodies were detected in this study. So the antibodies were not giving a proper idea of whether a cat is protected or not for herpes or calicivirus. In calicivirus, neutralizing antibodies, cellular immunity, and IgA, different calicivirus strains were circulating. Searching for antibodies have a limited value in these instances. So, however, many cats were protected even in the absence of the antibodies. So we have to think about the point of care tests for antibody detection because these hemagglutination tests and the virus neutralization test is hard to achieve to a normal practitioner. So when it comes to point of care tests, how do you choose? So you have to use approved independent scientific publications for your machine which you are going to choose. And you have to ensure accuracy and the reliability because this is testing whether a patient is protected or not. So when it comes to antibody detection, it has to be simple and quick. And these are like canine distemper, canine parvo, canine adeno, and feline panleukopenia have tests available. These can be expensive than the vaccines, but it has to be with the gold standards. You have to check the independent studies. Feline calici and herpes, not strong correlation as the protection is by cell-mediated immune responses. Therefore, there is no use of checking antibodies for these two viruses. So high specificity and high positive prediction value is essential when you are selecting a machine. When it comes to specificity, if a machine says if it is 80% specific, then there can be 20% of false positive. That means if we see false positive, we might ignore a patient who needs vaccination. So you have to choose wisely of what you get. Next, what to look for. So you have to look into the positive predictive value. So it has to be more than 90% or 90%. So it means that there are 90% of true positives relative to gold standard tests, which I have mentioned, hemagglutination test and the viral neutralization test. So these are the research articles. We can't go into detail in each and every study. So you can scan these QR codes for your reference. So these are the studies which have done many of the point of care tests. So for an example, there were 106 canine serum which was collected in this study for the canine distemper virus. So more than 16 titer was considered a protective by this machine. So the specificity for this machine was respectively 93.5 and 87.2. And in this study, point of care tests for antibody detection was checked in 563 samples and 431 pet dogs and 132 beagles who were in research. So they have used a machine called VacciCheck. A gold standard hemagglutination inhibition and virus neutralization was used. And the specificity of this machine compared was 87.5, 90.6, 94.3, respectively, for canine distemper, adeno, and parvoviruses. So the tests for feline antibody detection also was tested in the certain machine in 347 cats. So as you can see, it was having a good specificity, nearly 90 to after passing 80%, and the positive prediction value was more than 90% of all these tests. So this is what you have to look for when you are purchasing a machine. So when do we use serology? It is important to know when we have to use serology. So determining a kitty or puppy is protected, identifying the genetic non-responders. So this is really important. So I will talk to you about the canine vaccinations and serology, how they are advising us to use serology in these instances. So as I have earlier mentioned, if an animal comes to you at 6 weeks of age, you use the repeated doses at 2 to 4 weeks apart at 10 weeks, 14 weeks, and after 16 weeks of age. And they are advising to do the serology test after 4 weeks of the last dose. So if it is positive, we know this animal is protected. And you have to revaccinate the patient once in every 3 years for adeno, parvo, or distemper viruses. Now, if an animal is negative, that means there is no protected antibody level in this patient. So it is advised to revaccinate and retest in 4 weeks. So at this instance, if you prefer, you can change the brand of the vaccination and check if an animal is responding, or you can use the same one and you have to do your quality checks if there is a failure at your part. So you can give the vaccination at this age and then repeat the testing at 24 weeks of age. If the serology is negative, we take them at non-responders. So there is a certain part of animals, how much ever the vaccines we give, they are not responding to any of the vaccinations. So these are called non-responders for the vaccinations. So if it is positive, you can revaccinate them in every 3 years. So the window of serology testing for dogs is 20 weeks of age. When it comes to feline vaccinations and serology, if an animal is presented to you at 6 weeks of age, as we discussed earlier, 2 to 4 weeks apart, 10 weeks, 14 weeks, and 16 weeks were the areas where we have given the vaccine. So it is advised by the WASAWA committee to do the serology testing at 22 weeks of age for cats. If the serology is positive, then you can revaccinate for panleukopenia once in 3 years, and annual calicium and herpes virus vaccinations has to be done. If an animal is negative, that means you have to revaccinate and check just as the dogs in 4 weeks of age. That means you have to revaccinate them and check the serology at 26 weeks of age. If an animal is negative, that means it's a non-responder. And if it is positive, you can do the revaccinations once in 3 years for panleukopenia and once a year for calicium and herpes viruses. So in the point of care tests for antibody detection, there are poor immune responders, adequate immune responders, and superior immune responses. So again, when to use serology? Serology has to be replaced by the vaccinations in an annual health check and vaccination of an adult animal of unknown vaccination history. So this is really important to understand. Otherwise, mostly there is a widespread of fear by most of us. If an animal comes to us once in 3 years, then that's going to be a problem because we don't know the animal anymore. We don't know their history. We don't get to do the health checks. So it is important to mention the importance of serology to our clients and to check the patients every year for the serology test to say whether an animal is protected. So in this test, it gives a really big reliability for you and for your vaccinations by the serology. It is important to show it in a document to your client to say that an animal is protected. So you can replace serology from the annual health check and the vaccinations. Now, for annual health check and vaccinations, you don't have to be scared of not having clients around. So ticks and worm medications, administer of vaccinations in Sri Lanka, rabies and leptospira has to be annually given. And dental checkups are really important. Theta testing, the serology testing has to be done, and body condition score checkups can be done. Dogs and cats that have suffered from an adverse reaction. So sometimes some of the patients suffer from adverse reactions for some of the vaccines. So type 1 sensitivity, or in an example where in the Professor Mary Maconder's presentation, she has mentioned that there was a puppy who had a reaction of immune-mediated thrombocytopenia at 4 years, and thereafter no vaccines were given until 14. She was seropositive still for most of the diseases. So they didn't have to give the vaccine again. They didn't have to put this puppy in a bad state because of a repeated vaccination. And vaccination of immunocompromised cats. So this is really important to understand. So there are FIV positive cats in Sri Lanka. The incident rates are higher than we all know. So we have to test these cats for FIV before we give the vaccinations, because antibodies against panleukopenia should be determined, because FIV is an immune-mediated disease. So when we give the injection, sometimes the immunity is riled up, and then the cats become really sick after the vaccination. So that is because most of the cats are FIV positive. So we have to know the immunocompromised situation of these cats before we give the vaccine, specifically if a cat is roaming outside. If the antibody measurement is not possible, booster vaccination in adult indoor cats. If you can't have this serology testing, indoor cats are not recommended. If exposed to panleukopenia, herpes, or calici, only core vaccine should be administered. So you have to be really careful in repeated vaccinations to these animals. You can advise the clients to keep them indoors. Contrary, in feline leukemia virus infected cats, regular vaccination against panleukopenia, calici, herpes, even cats kept strictly indoors has to be done. Outdoor cats must also be vaccinated against the rabies. Protection of FELV infected cats might not be as complete as long-lasting. Either vaccinate them annually or determine antibody levels against the panleukopenia. So unlike FIV, in these cats, we had to do the regular vaccinations, or more tiny windows has to be used than the regular vaccinations to protect these animals because they are highly immunocompromised. So management of disease outbreaks in shelters, it is important to understand the basis in distemper, andino, and parvoviruses. Animals in shelters do all antibody tests. So if it comes to an outbreak, you have to do serology for all the animals in the shelter. If it is seropositive, that means these animals are protected. So you can basically separate them for a certain area. If an animal is seronegative, probably they are susceptible for the disease. Therefore, you should isolate and vaccinate. You have to do both, isolate and vaccinate these patients. And you have to take a repeated antibody level to see if an animal is protected by a certain disease. And about entering into a shelter at an instance where a disease is prominent, you have to check serology. Protected ones may enter. And if an animal is susceptible, you have to vaccinate and send them for foster homes as soon as possible without getting them into the site. And they should not be allowed to enter the shelter until they have seroconverted and have protective antibody levels. Proven immunity for exhibitions and to stay in hotels or boarding places is really important. So thank you very much to listening in. So I think it is time for questions. So thank you for your attention and feel free to ask any question. So while somebody puts down a question, I'll also mention about the anti-rabies guideline a little bit. So there was a study of Sri Lankan dogs by Professor Mangala. In this study, she has taken 4 groups of dogs who were having a past immunization history 1 to 5 years in the group A, and who didn't have a past immunization history 1 to 5 years in the second group. 3-month-old puppies with previous immunization bitches were in group C. 3-month-old puppies of unimmunized bitches were in group D. So in these dogs, they have given the vaccination and they have checked the antibody titers after 1 month of immunization and in 1 year. So they have found out that we didn't have a need of giving another vaccine to these dogs because they had high antibody levels. That is why we don't need to repeat the doses in these animals again in 1 month or so. And in the second groups, all dogs protected level 30 days after immunization. However, if the dog was not having a past immunization history, only 87% of the dogs had the protective level at 6 months, and 50% of animals didn't have a protective titers after 1 year of immunizations. So that means we have to do a repeated dose if an animal is not having a history of previous vaccinations. 3-month-old puppies who were having immunization, previous immunization bitches in the group C, antibody development 1 month after immunization after single dose of rabies was poor in puppies compared to adult dogs in group B. So therefore, she has advised to do repeated dose 2 to 4 weeks apart and 26 weeks and also in annual. I'll explain to you why the 26 weeks was essential. And in 3-month-old puppies of unimmunized bitches were in group D. 26% of the puppies in group D did not develop antibody titers above the protected level in 1 month even. And 75% of the puppies in group C and 93.3% of the puppies in group D did not have protective antibody titers at 6 months' time. Antibody titers in 6 months' time, samples of puppies in group C and D were below the protective level. So therefore, she advised a repeated dose in 2 to 4 weeks, 1 dose, and again at 26 weeks and annual doses. In India, there was a study saying 60% of rabbit dogs were less than 1 year old. Many are puppies below 3 months of age. Therefore, they have advised repeated doses. Thereafter, a booster vaccine should be given at a suitable interval as the protective antibody titers were not maintained until 6 months in the majority of the puppies. That's why I mentioned 26 weeks of age was essential. So up to you, over to you, Dr. Chandika. I think it's time for the questions. If you can unmute your phone or up to you.
Yeah, thank you very much, Dr. Yushika. That was a very detailed and descriptive presentation. And what impressed us most is now almost all your slides were like supported by very good research articles or publications. So that was a really good presentation. Thank you very much, Dr. Yushika. So the presentation is now open for discussion. If you have any questions, if you want to ask questions, either you can directly ask the questions, or else if you don't want to raise your voice, you can type your questions, then Dr. Yushika can directly answer those questions.
Dr. Janet, can
I? It's a good presentation. Anyway, it has opened up some more ideas. Can you just give me some more clarification? When the mother is immunized and when the pups are feeding, so when we should vaccinate for the rabies, for the pups?
If the mother is immunized.
Yeah.
So that is at 10 weeks is the recommendation, doctor. If the mother is non-vaccinated, then at the earliest we see is the guideline we have for Sri Lanka.
As earliest, yeah. Then what the booster? Again, 1 month?
Booster has to be, yes, 2 to 4 weeks apart. And specifically, it has to be 16 weeks is the guideline in the bulletin. I think 14 to 16 weeks. So otherwise, we will be sort of missing the maternally derived antibodies. If the mother is vaccinated, 16 weeks should be the next dose. And if a puppy is not vaccinated for rabies, 2 to 4 weeks apart, a vaccination. And then we have to repeat the dose at 26 weeks of age, because usually, as I showed in Professor Mangala's research, the maternally derived antibodies and also the antibody titer levels has fallen down in these puppies at day 180.
Even after giving the first vaccination to the pup?
Yeah, that's what that's what the research was, doctor. I mean, this is totally based on the research. So they have done this research. I'll also share the research with you. So in the slide which I have shown you earlier, so they have seen that there was a big the antibody titers were getting low. So therefore, it is always advised to give a 26 weeks and an annual vaccination at this state.
Good evening, ma'am. This is Dr. Nalin from India. I just wanted to ask. I just wanted to ask if the status of mother is not known against rabies vaccine, what is the earliest age of the pup where the vaccination can be done, especially in the stray dogs, stray canines,
Yeah.
where most of the cases are being encountered?
Yes. So, doctor, you have to always, the Vasawa guideline always mentions that you have to always think about the guideline which is provided by your country. So, what I talked about is which is related to Sri Lanka in here. So, you have to, as I said, you have to always look for the guideline which is specified for India by the government. So, in Sri Lanka, it is the instant where we meet the puppy. So, if a mother is not vaccinated, as soon as we get the puppy, they are advising us to give the vaccine at that instant. That's what we usually do.
Right, ma'am. Right, ma'am. And
Thank you,
Okay.
Doctor. Dr. Janit has been waiting for a while. Dr. Janit, over to you.
Hello.
Yes,
Thank you.
doctor.
It's a very well planned and presentation. And I have a question. How do you mediate the manufacturer's recommendation with Vasawa protocols?
Well, doctor, for an example, now we do have a certain vaccine of feline. So even though the Vasawa mentions 6 to 8 weeks of startup point,
Yeah.
it has to be given after 8 weeks. So we cannot override that recommendation, because sometimes if we give a earlier vaccination just because of the Vasawa guidelines, sometimes these cats tend to get really sick. So you have to always go for the guideline of the vaccination, the specific brand. You have to read that, because they have been encountering side effects of earlier vaccinations. Though therefore, you have to override the Vasawa protocol, and you have to select the timing which they provide. If it is after, say, basically, if it is a little later, they are suggesting, you have to go with that.
Okay. Right. Are you planning to have a national policy, either through SLVA or any other organization? Because
I think that is really important, doctor, and it is very timely. So that's why even Dr. Sugat is the one who really, he was really eager, and he suggested it many times that we have to do this. So that is, with his motivation only, I started, giving this presentation. So I think it is really important that we have to get together and provide ourselves with the national guideline. Yes.
And also to import the necessary vaccines, like regulations are there.
Yes.
If you have to give leptospira annually, so we
Yeah.
have to have it separately.
Yes, doctor.
Like for cats. So if you have to give 2 vaccines, if the other vaccine you have to give annual, then you have to give all 3 annually. So can't we get the other preparations, or is there any request or any way of getting?
No, doctor. We actually have vaccines now. I think I'm mentioning these brands because nothing to declare personally of conflict of interest. But I would mention several brands. We have the vaccination separately. For an example, in Nobivac, I think they have the leptospira separately. So you can give the leptospira only separately at that instance. And when it comes to Boehringer Ingelheim, so they also have leptospira separately. So you can give that separately, doctor. And also when it comes to RL, you can just give it separately as well without giving the DHP part.
That's right. Then for cats?
Cats, of course, I tried talking to many companies regarding the, like the dual vaccinations without over vaccinating the panleukopenia part.
That's right. That's right.
Personally have made requests from the vet hub. So I've been trying to do that. So I think we all have to get together and, provide them with a request, because otherwise we will be invainly vaccinating them. Yes.
That's right. Yeah, it's a good initiative. Thank you, Yushika. It's a great presentation.
Thank you, doctor.
Thank you, Dr. Janit. Dr. Yushika, there are a few questions that has been typed. Do you want me to read them?
Yes.
Or,
yes, it'll be great.
So
yes,
the
thank you.
first one is, the challenge here is not knowing if the mother was vaccinated or not. Then what schedule do we follow for stray pups?
Well, if the mother is not vaccinated, but Vasawa has mentioned now, if it is a really tiny puppy, like always we have the antibody titer test. That's why I mentioned the importance of the serology. So if we have a dog or a puppy who's having, say, imagine somebody gives you a puppy, I don't want this puppy anymore, and they don't provide you with the booklet. So that is where the serology comes in. So we can test the blood for the antibodies. So then you can exactly know whether they have proper antibodies in their blood.
I think Dr. Aarti's question here is, I think it's a practical question.
Okay.
How to know now? The challenge here is not knowing if the mother was vaccinated or not. If a puppy is presented by a person, say when they are about 10 weeks of age, and the guy doesn't know whether the puppy's mother is vaccinated or not. In that
so
case,
if we don't have serology, I think, doctor, maybe we will have to take them as non-vaccinated in an instant where we don't have serology.
Yes.
Because, like there's absolutely no other way to know. So how much ever we try, we can't predict it if we don't have the serology test.
Yeah, so practically we'll have to assume that is a puppy from a non-vaccinated mother and then go with that presumption.
Sure. Yes.
And then Dr. Supun has a question. There are so many new vaccine brands in Sri Lanka now, since there are any proven study which are the brand that reached to serological levels. I don't know whether this is specifically for rabies or any other vaccines. I don't know whether you can answer this question since it involves the names of the brands.
Okay, so to be specific, there's anti-rabies vaccination by Professor Mangala. There is a study which has all the brands which is available. At that time, she did the study in the research article. So she has mentioned about the vaccinations which has worked properly depending on the serology tests she has done. I think if I will probably share that article with you in the SLVA group, so you can refer to it. So even the brands are mentioned there. So apart from that, we don't have proper serology studies for panleukopenia, distemper, or parvo in Sri Lanka. And apart from that, I think most of the veterinarians have personal experience who are importing and exporting animals from our country. So most of them are sending the antibodies testing abroad, so they can have a proper idea about, like what sort of vaccinations the patients has used and whether they have achieved a proper antibody level. So those are the areas which we can look into. But then again, unfortunately, we don't have any answer for panleukopenia, parvo, and distemper.
Right, thank you. And before we move to the next message question, Dr. Tusita has been waiting to ask a question. Dr. Tusita.
Hello, doctor.
Thank you, Chandika, and nice presentation. Can you hear me?
Yes, we can.
Okay, so just to clarify something, do we have the vector vaccine for the companion animal in Sri Lanka? In Sri Lankan market. Can you hear me now?
Yeah, I didn't hear what sort of vaccine you mentioned.
So vector vaccine. Vector vaccine means the DNA vaccine I'm asking. Okay.
We have recombinant DNA technology vaccinations in Sri Lanka.
Not the vaccination. I'm asking any vaccine available. Recombinant DNA vaccines.
Yes, it is available.
So for what diseases? For the rabies?
Rabies, of course, no. Parvo, canine parvo, canine distemper, and canine adeno. And leptophyte in that specific vaccination, I think there were 4 zeroas available in that vaccination for leptospira as well. So there is a vaccination with the DNA technology, yes.
So the vaccination schedule that they have indicated for the recombinant vaccines are differ from the usual vaccine schedules that we are practicing here in Sri Lanka?
I would say the WASAVA guideline, which we have been talking about, because like several vaccinations are mentioned in several different protocols, as I have mentioned earlier, because we've been just doing it in so many different ways, all of us. So how much ever, I think we have to go with the national guideline again. And also WASAVA guideline always mentions that you have to give a final dose, because like in the recombinant DNA technology, it says that the maternally derived antibodies in some of the instances specifically interfere. But again, I mean, apart from that, in the manufacturer guideline, mostly it is we are supposed to give multiple vaccines, as I have mentioned earlier. And I
Yeah,
think, Doctor,
why I'm asking this question specifically is that the MDA will not be a problem for the recombinant or the vector vaccine. So because of that, in your schedules, as I see very clearly, you are giving like 3-4 vaccine shots for the pets, right?
Yes.
So we can minimize that part by giving the the vector vaccine first, where the MDA is going to be a problem, right? And then we can start the normal other vaccine once the MDA part is gone away. So that's how we do it in the poultry as well. So because the IPD is a problem, it's a classic example. So because of that, we use the vector vaccine for that. So the same way when we go for the the national program and making the new schedule, so we can include that part as well. Okay. And another thing I want to just to comment on that. So when we look for when we are going for the new vaccine schedule, I think it is better to look for the T half of the antibodies, IgG, when we look for the schedule making, right? Otherwise, it will be a problem because our population is quite different from the population that they have tested in the overseas. So that is what the Professor Mangala was done. But here I think we need to look that aspects as well. So just a comment on that, okay?
Yes, Doctor.
Thank you so much, and nice presentation. Okay.
Yeah. Thank you so much. I think we have to always think about the serology testing as well, to know whether all these vaccines are working properly. I think that is somewhere we have to look into adapting serology to our clinics as well. So we will know answers more clearly than just discussing. So I think we can invest on that as well. Dr. Chandika, is there any questions?
Thank you, Dr. Tusita. Yeah, there are a few message questions. Another question from Dr. Arti. A pup from distemper recovered mother, will she have maternal derived antibody?
If the mother had distemper before, I think they should have it, yes.
Right, okay, thank you. And Dr. Ruanti has a question, a practical question. Is there serological testing for antibody titers in Sri Lanka? I don't know whether she is referring to human one or animal one regarding anti-rabies or any other one.
Well, doctor, I think, okay, we'll give an answer for all of that. So when it comes to human testing, that means for us to get tested, we had a chance from the what do you call the Medical Research Institute before to get ourselves tested before this every 5-year vaccination. So in the recent past, we had that opportunity because they didn't have the test kits available. However, we were discussing with the public health section whether to have it back again so we can test ourselves. So if they come through with it, then we'll let you know. And when it comes to the animals, I think based on the times of the research they have done, so when they were doing research, they had the antibody testing for rabies in MRI. In commercial way, there are certain companies who offer the antibody tests for parvo, distemper, and adenoviruses. But then again, as I told you, that you have to always these point of care serology testing, and you have to compare it with the gold standards, the viral neutralization and the hemagglutination tests based on the individual research. So most of the companies who have these, point of care machines, they do have this testing available in them, yes.
Another question from Dr. Haripriya. If a pup of a vaccinated bitch is separated at six weeks of age, a pup of a vaccinated bitch separated at 6 weeks of age, when can we vaccinate the pup?
If you receive the pup at 6 weeks of age, as I mentioned, that you can start that vaccination at 6 weeks of age. So even though the pup has been separated from the mother, definitely if the pup had the chance of getting colostrum from the mother, so there are certain maternally derived antibodies circulating in his system. So you have to use these multiple doses to these pups to elicit an immune response, and specifically one you have to go with the serology testing. So just the same. So it is really important that you start the vaccination despite the status of the mother with the guideline.
Right. Thank you. And I think you wouldn't mind answering few more message questions, would you, Dr. Yushika?
Yeah, no worries.
So Dr. Purni has a question. If we get a dog bitten by a properly vaccinated dog against rabies, bitten by a stray or not properly vaccinated dog, do we need to administer an ARV vaccine at that time?
Yes, doctor. I in the bulletin also, we have to always, if a vaccinated animal has been bitten by an unknown history of an animal, you have to give a dose of anti-rabies just as the post-exposure. I'll try to find that slide for you. So you have to give one dose. If an animal is not vaccinated, then you have to go with the day 7, day 14 and 28 post-exposure schedules. So if you have a vaccinated animal who has bitten by another animal who's not having a history, you have to give another dose after as a post-exposure. Yes.
Thank you very much. And there's one final question. That's a medical question by Dr. Chamika. How long do we have to wait to vaccinate a dog or a cat after infection? Is there any specific answer, or it depends on the clinical picture?
I think it should depend on the clinical picture as well. So personally, I would wait, at least 1 month if it is a parvoviral infection. So you have to always, look into the clinical picture of the animal that, when it comes to modified live vaccines, you have to make sure that these animals are in proper health rather than just giving the vaccinations as soon as possible. So you have to make sure, as Dr. Chandika said, you have to wait for the clinical picture to be correct.
Right. And one last question from Dr. Ruanti. That's also a practical question, a logistic question. Dr. Yushika, do you know the cost per kit for the serological testing?
I think it was around 3,500. I think 2,500 to 3,500 was the cost. So it basically is higher than sometimes the vaccination, but then again, with the correct advocacy and if you tell a client that over vaccination is not so good, and you can really straighten it out by serology testing, I think depending on where you practice, most of the clients would agree. And despite, it also removes the vaccine cost if the animal is protected. So this is the cost as far as I know in Sri Lanka.
And also, I think, Dr. Yushika, it depends on the degree of care that you provide to your four-legged family member. Now, especially in like Colombo area and suburbs, the pets are considered as like family members. So I think even they would be okay to send if there's no serology testing available in Sri Lanka, they would be okay to spend 20,000 rupees and send it to one of those popular laboratories in Europe.
Yeah, that's true.
So it, I think, purely depends on the circumstances, whether the client is willing to take good care and spend that amount, or else it's just another like dog or cat that he has come across.
That's true.
Is there any time for a question? Last question.
Of course, Doctor.
Yeah, thanks. The thing is, if a dog has been vaccinated, say 2 or 3 years properly for against rabies, and if the dog has been bitten by an unknown dog, say after the last vaccination, say 1 month after the vaccination, should we revaccinate the dog?
So what you ask is, doctor, if an animal is being vaccinated 2 to 4 weeks, 2 to 4 years ago.
No. Continually, the annual vaccination has been given to a dog.
Okay.
And the particular dog was bitten by an unknown dog.
Yeah.
Which that was that the dog A has been vaccinated. Say this year vaccination has been done 1 month before, but after that it was bitten by another dog, unknown dog. So do we have to vaccinate again?
Well, doctor, practically, I think the antibodies will be still circulating, but I think as per the guideline, we have to give another dose, post-exposure 1 dose after the vaccination, as far as I know. Because this is a specific category of instance, I'll have to refer to it more. But as far as I know, yes, you have to always give a post-exposure vaccination if it is an unknown animal. Yes.
Yes, Dr. Yushika, we had to give a tetanus toxoid as well at that time.
Yeah.
I think this rabies, like repeated doses must be coming from the fact that rabies is a deadly disease. Even though the dog may be like highly protected when you give several years of like 2-3 years of annual vaccinations, we know technically there's a really good amount of the antibodies circulating, so they are protected. But I think since the rabies is a deadly disease, whether it is a dog or a human being, that may be the reason why they like recommend getting an extra dose kind of, even though the dog is fully vaccinated. Just a comment on that.
Yeah. Okay.
Yeah, and that is correct. But the thing is, if the duration is very short, say 3 weeks, 3 weeks before that fellow was vaccinated, annual vaccinated. So still it is on the process, right? So giving another vaccine will do have an effect.
Well, doctor, it's again, like we don't know whether if say basically serology, so this is a specific instance you are mentioning. So because this is a deadly disease, we have to always follow the guideline as Dr. Chandika said, because like we have to be legally correct as well. So if we have a guideline which says that we have to give a post-exposure despite the situation is, I think it is better to follow the guideline in these instances to avoid any legal issues. So I think maybe I'll do more research about the question whether we have to, if it is doing any harm for this animal if we give it. But other than that, I think
in where we have high number of community dogs and the stray dogs. So in that aspect also we need to, care about it. Thank you.
Doctor. Of course.
Nice.
And also just another comment, I think it's a matter of like improving ourselves professionally. Now, say for about 15 years ago, we didn't even do a full blood count as a routine thing. But now we don't 100% depend on our clinical expertise, palpation, auscultation, but we do the testing also. So same here, I think we'll have to, even though it's expensive and even though it's not very psychologically familiar to us, now it's time to do like more serological testing in these things. Otherwise, we can't just come up with an opinion without the actual objective test results, I think.
Yeah, that is correct, doctor.
Yeah, I think that's all. If the audience, thank you very much, Dr. Yushika, for tolerating all these questions. So I think we have come to an end, and some doctors asked for whether you are going to share the presentation.
Sure, doctor. I can, I think most of these presentation, as I said, that the credit should go to Professor Mary Marconda's presentation. So this is not an intellectual property of mine. So most of it I have straightly taken it from there. So surely I can, share it with the SLVA community. I think better not to share it anywhere else. So
right,
because
and also
it's
this
not
lecture will be anyway like recorded and kept in the SLVA
in the
YouTube channel also. So any doctor can come back and yes, refer to the full lecture. Okay, right. Thank you very much, Dr. Yushika. Over to you, Dr. Udita, Secretary of SLVA, for the vote of thanks.
Dr. Chandika, Dr. Udit is not available, so I will do the vote of thanks.
Right, okay, thanks.
Okay. Thank you very much, Dr. Yushika Dharmasuriya, for conducting nice presentation. Actually, we happy and we proud of you. We highly appreciate your method of teaching. And Dr. Chandika, thank you very much for moderating today webinar. And also, I would like to thank all the participants from different regions in the world to success today event. And also, Dr. Um, um, that Janit Gunasekar asked some questions. Are we going to make a national protocol for vaccination so we will discuss it and we will give you the update to you, because as SLVA we can't do alone it. We have to cooperate with our other sister association, government officials, and TAPH as well, and the university as well. So later we will give update to you and all the community. And thank you very much for joining today webinar. Thank you. Good night.
Thank you. Good night.
Good night,
Good
doctor.
night.
Good night.